I was trained to give insulin potentiation therapy by Dr. Donato Perez Garcia, who's one of the most amazing people that I've ever met. He's a kind, caring physician, a very good role model, and an incredible mentor to me and other doctors who do insulin potentiation therapy. I was fortunate in that the first doctor ever trained in the United States, Dr. Stephen Eyre, lived in the Chicagoland area. So the very first patient treated in the United States with insulin potentiation therapy was actually my patient. And Dr. Eyre did the treatment in our office, my office, Caring Medical in Oak Park, Illinois. That very first patient, Dr. Eyre and I were 100% convinced that insulin potentiation therapy was safe and effective. Over the course of 3 or 4 months, this patient had her breast cancer metastases completely go away in the liver, in the bone, in the skin, in various organs in her abdominal cavity. Right after that, he then set up his clinic, Contemporary Medicine, in Burr Ridge, Illinois, and started doing insulin potentiation therapy, and then we started it at Caring Medical. Over about a decade of me using insulin potentiation therapy in the treatment of cancer, I can tell you emphatically that it's effective and it's extremely safe. Patients would regain their appetite while they were under active treatment. So instead of traditional chemotherapy, which is high dose, low frequency, where you would get a lot of side effects, insulin potentiation therapy was basically low dose chemotherapy but high frequency. So we would see patients about once a week. And even after the first visit, most people would start feeling better. So you could actively give a chemotherapeutic agent to cause the tumor to shrink and start to go into remission, but while they were undergoing the treatment, they retained their hair, they retained their energy, they had an incredible appetite. So besides just being effective for cancer, the quality of life was amazing while people got insulin potentiation therapy. So it absolutely helps improve the quality of life of cancer patients, and if a person comes in right away and receives insulin potentiation therapy as their primary treatment, it's extremely effective at getting them into remission. If I was diagnosed with cancer, I would see an oncologist, the very best oncologist that I could, get their regime, so I knew what chemotherapy agents were the most effective using traditional medicine. But I would choose insulin potentiation therapy because you can use the same chemotherapy agents and potentiate their cancer-killing effects with insulin and other agents. So you get the same cancer-killing effects of the chemotherapy agent, but in low dose. So while you're getting the treatment, you actually feel better. So you feel better, so your health is improving while you're getting an active cancer treatment. This is what makes it so amazing. It's very exciting, inspirational, if you will, to be around people who want to make a difference, who understand that the way cancer patients are treated around the globe is actually not ideal. They're actually undergoing high-dose chemotherapy, so they actually go to physicians who are experts in high-dose chemotherapy. They're actually not experts in cancer, because to be an expert in cancer, you would have to know what causes cancer, what cancer physiology actually is, and then how to reverse that cancer physiology while you're actively treating them, and what needs to be done so the cancer doesn't recur. So doctors who get involved with insulin potentiation therapy are true cancer doctors. They treat the person as a whole. They know the heterogeneity of cancer. They know all the different etiological factors that make a person more prone to cancer, and also then how to resolve it by doing a holistic treatment program that involves insulin potentiation therapy, because you have to do something that actually is going to cause the tumor cells to die. But while the tumor cells are dying, guess what? The rest of the body's getting more alive and more healthy. So in the end, you have the person get the optimum treatment. And that's basically what this conference is about. This is what Dr. Donato Perez Garcia is about, and that's what us doctors who get involved with his work and the promotion of insulin potentiation therapy around the globe to not just help cancer patients resolve their cancer, but actually reverse what caused it and keep the disease at bay.